Korea's COVID-19 strategy amid Omicron is centered on treating the severely ill and expanding vaccine-induced protection within the public. For more, I have Dr. Kim Seung-taek from Institute Pasteur Korea. Dr. Kim, welcome back.
Good afternoon.
I also have Dr. Alice Hyung-kyung-dan at Ms. Medi Women's Hospital live on the line. Dr. Dan, again, it's a pleasure to see you.
Always a pleasure to join you.
Right. Dr. Kim, health authorities claim that the current spread of Omicron, as alarming as it is, will eventually pave a path to a sense of stability in the long run. Do you agree?
Yeah, to some extent, I actually did agree to the opinion, and I think within this very short period, it's going to be a little bit just challenging. But as everybody knows, that the number of just the total case numbers will increase, and then subsequently the severe case numbers will increase. But I hope that the numbers will be still just within the limit that our healthcare system can just actually just handle. But in the long run, I think the kind of just nature somehow just chose the way this the Omicron just does go in the end, and then this Omicron infection will actually just expedite the immunity in the population level. So there are some people who are still not unvaccinated. In Korea, it's less than 15%. But then with this Omicron infection, they will get this immunity by the natural infection. So in the population level, maybe just Korean people will get just higher level of immunity, whether it is a vaccination or just a natural infection.
Right, I see. Now, as my colleague Min Jung mentioned, Dr. Dan, some say the speed of the Omicron spread here is surpassing early expectations by experts. What are your thoughts on this?
Well, to understand the transmission dynamics of any respiratory-borne viral illness, we need to understand the virus factors, the host factors, and the environmental factors. But let's look at what's happened overseas in some countries. For example, South Africa. Of course, their Omicron first case was detected from a sample drawn November 9th. They peaked December 15th. So their 7-day case average, daily case average, actually went from 275 to 27,000 over a period of 5 weeks. So that's 100-fold increase in daily new cases in a 5-week period of time. In the UK, their Omicron wave started November 11th. After 8 weeks, they had gone from a baseline of 34,000 new cases a day to close to 200,000 new cases at their peak. This is a 6-fold increase. Here in Korea, our first case arrived November 24th, but they were not detected until December 1st. Right now, it's 13 weeks since our first cases, and we've gone from a daily average case load of about 4,000 to now the average is 110,000. So it's about a 30-fold increase. So what's going on in our country is, of course, we have the highly transmissible Omicron variant that is close to impossible to contact trace. We've sort of given up on that. And we had lack of universal quarantine early on. So the virus was brought into our country on multiple flights. And of course, domestic chains of transmission were started at that time. And then we have host factors in terms of a large pool of people who are unvaccinated and also under-vaccinated. We have to remember that the Omicron variant evades vaccine-induced immunity for many of the vaccines after 3 or 4 months, and 11 million people have received either 1 or 2 doses of the AstraZeneca vaccine, which especially has a low vaccine effectiveness against Omicron. We also have about 6.5 million people who are unvaccinated or under-vaccinated, including 4.2 million children. And they are, of course, acting as reservoirs for the virus right now. And then in terms of the environmental factors, of course, it's the middle of winter, it's cold and dry, people are spending more time indoors. And in terms of level of stringency of our restrictions, they're really maybe moderate at most in terms of intensity. They're certainly not at a high degree of stringency. And so these are all the factors that have led to the big rise in cases. And I think also because we don't have wastewater surveillance, looking for early signs of infection, we've developed a large pool of asymptomatic people who are carriers of the virus in the population, and they're really driving the surge right now.
Right. Meanwhile, Dr. Kim, Dr. Tan mentioned the more than 4 million children that need to be vaccinated here, that remain unvaccinated, that is, and perhaps to better protect them, given the rise in infections among children, authorities have approved Pfizer vaccines for children aged 5 to 11 here in the country. Do tell us a bit about the differences in dosage for children as compared to their adult counterparts.
Well, major differences compared to the some older age group is just as you said, is a dosage, and for the people just between the 12 and above, the amount of this RNA actually administered to the person is actually 30 microgram. But this the young children between the ages 5 to 11 is 10 microgram. So it is actually the 1/3 of the conventional the RNAs. So but the intervals is very similar. For this group of the people, actually government actually just planning just the 2-shot program, the 2-shot program with the 3 weeks of interval. So this is not really just different compared to the some older age groups. But then they are not considering any the third shot at this moment, except for the some immune compromised children as of now.
Right, I see. And Dr. Dan, based on very general findings here in the country, it appears that most children experience mild cases of COVID-19. Having said that, do you still believe they need to be inoculated, though?
So I do agree that for most children, the Omicron variant and COVID in general is a mild disease, sometimes asymptomatic, but we need to keep in mind that it can also be a fatal disease in children. We just added 2 more fatalities in the pediatric population overnight, bringing our total to 6 deaths in children in our country since the beginning of the pandemic. 7 more children were added to ICUs overnight as well, bringing the total to 11 kids in ICUs in our country currently. And 600,000 children have been infected since the beginning of the pandemic. We have to remember also that about half of children who get COVID also get long COVID, and there is no cure for COVID in children. There's no cure for long COVID in children. From a public health perspective, children are acting as reservoirs for this virus. They're spreading the infection amongst each other, and now they're spreading the infection to their parents at home as well. Many people are calling in sick because they got COVID from their kids at home. I think, goes without question that the impacts of COVID-19 in children have been tremendous. I mean, school closures, the anxiety provoked by this pandemic. I think at a minimum, 5 million children have lost either a mother, father, or a caretaking grandparent during this pandemic. And so this all needs to stop. And the only way that we can bring our world closer to the end of the pandemic, not just for children, but for everyone, is through vaccination. So children need to get vaccinated to protect them against the severe effects of COVID-19, but also so that we can end the pandemic for everyone.
Right. Then having established the importance of vaccination, Dr. Tan, what needs to be carefully considered when choosing to vaccinate children against COVID-19?
Well, first of all, the only contraindication against the Pfizer vaccine is having had a severe allergy to any of the ingredients in that vaccine. Otherwise, there are no strong contraindications. We know in terms of side effects, they do tend to be quite frequent in children. Local side effects include pain, swelling, redness at the injection site. In terms of systemic symptoms, there's fever, chills, headache, muscle aches. Also, children seem to have a higher degree of gastrointestinal side effects, such as nausea, vomiting, and diarrhea. They could also have rash and lymph node swelling, fatigue. So keeping this in mind, I think parents should maybe plan out the activities for their children around the time of the vaccination. Maybe make sure that there are no big sports events or no big tests that they need to take right after vaccination. But the most important thing, of course, is for the children to get vaccinated.
Right. And Dr. Kim, some studies show that 3 doses of Pfizer's mRNA vaccine may offer years of protection. What are the implications of this particular finding?
Well, I have to say the two main aspects of our immune response by the vaccination. The first one is antibody production, and the second one is sort of just cellular immune response. The main the job of these two responses is different. By the antibody production, antibody is actually blocking the virus infection to the cells. But in the end, on the other hand, the cellular immune response, which is mediated by the T cells, actually destroy already infected cells. But so the antibody response is not really long-lasting. Upon the most of the vaccine platforms that we are using right now, antibody response is actually waning after 3 or 4 months after vaccine a shot. So, but on the other hand, this cellular immunity is very long-lasting, at least until the 6 months after the vaccination. So that's why this vaccine is actually seems to be protect the people against the severe disease and even some death. And then many vaccines actually were developed to prevent the disease, not the infection. So I think on the overall, our expectation for this particular COVID-19 is that whether we could do the vaccination, the program, like some annual flu shot, or the other option is that we have already some endemic coronavirus infection. That those coronavirus, we do not have any vaccines, and then we are actually doing any vaccination. So once we reflect on the past coronavirus infection, maybe the situation might be that we do not need a vaccination anymore after the third shot, because our upcoming more variant or like other some very similar coronavirus might play a role of the booster shot itself. The virus itself could play a booster shot. So in this case, we do not need vaccination anymore. Right. So there are two actually potential scenarios for now. Yeah.
Right. And moving forward, Dr. Dan, what changes do you propose within our overall medical system as healthcare workers seek to address the latest rebound in COVID-19 infections here?
Well, one fundamental problem was the lack of isolation rooms, I think, with proper airborne precautions in hospitals and throughout the wards of the hospitals, also emergency rooms at the hospitals. So I think this is one fundamental change that may take some time, but we do need to address. Another change, of course, is the implementation, the legalization, the support of telemedicine. This needs to be a way of practicing medicine that is fully legitimized in our country. We need to improve our EMT, emergency transport ambulance fleet. Some of them are not equipped to really deal with potentially life-threatening conditions en route to the emergency room. And I think we also need to consider building regional infectious disease hospitals, freestanding hospitals that can treat women who are pregnant, surgical cases, children, people who have infectious diseases in one freestanding hospital. Some of these changes I know will take time, but I think the pandemic has really made these changes necessary in our healthcare system in our country.
Right, and staying with treatment efforts, Dr. Kim, how do you assess the rollout of Paxlovid here in the country?
Well, even in real world, the Paxlovid efficacy is pretty good. It's very similar to the what we observed in the phase 3 clinical trials, so which is good. But then the thing that happening is that the number of prescriptions, well, compared to the quantity that we have already acquired, is actually smaller than the government actually expected. And I think the doctors somehow hesitate to just giving out the prescription, because there are some concerns about some adverse effects and some drug-drug interaction. But I think this situation also reminds me of the what we actually observed in the some monoclonal antibody developed by the Celltrion. I mean, this is not just unique to Korea, but globally, some doctors are very enthusiastic about some monoclonal antibody treatment, but others are very hesitated. And even just access to this monoclonal antibody was not somehow just restricted. Not every big hospital did not have the just monoclonal antibody in this case. So I think there should be some more just more prescription to be actually just distributed to the patient who will need this Paxlovid treatment.
Right. And very briefly speaking, Dr. Kim, because I believe I have touched upon this question with you previously, how are we progressing on our own efforts here in the country to develop a drug against COVID-19?
Well, actually, the domestic company actually collaborating with some Japanese pharmaceutical company to develop the some small molecule inhibitor. This the drug is very similar to the some Paxlovid in terms of some mechanism of action, but I think there are some some better aspect of this drug, and this is currently a phase 2 or phase 3 clinical trials right now. I think this and then this whether. Depending on the some outcome of these clinical trials, we will have maybe some additional weapon for the some coronavirus infection. And then also for monoclonal antibodies, so our Korean company sHospital also developing some monoclonal antibody now also have a neutralizing capacity against Omicron itself, but the old one did not have actually good neutralizing capacity.
Right, I see. And Dr. Dan, for those who've been boosted, Omicron appears to be as lethal as the seasonal flu. This is something that my colleagues and I touched upon this week. Now, keeping this in mind, how do you believe should we proceed with our containment strategy?
Right, so that's the good news. And I think we all need to understand that we're never going to be post-COVID. COVID is going to stay with us maybe forever, but we can be post-pandemic. And that will only occur when enough people have enough levels of immunity to make the COVID disease less lethal. And so that's going to happen through vaccinations. We have to make sure that we reach out to the unvaccinated, get them started on their vaccine series. And then also we need to make sure that everyone who's eligible for a booster, third shot booster, gets that shot because, as you said, it decreases mortality rates. People who are vulnerable, who are due for their 4th dose also, they need to get their shots as well. So in my opinion, given the fact that we have now more than 900 deaths due to Omicron in the month of February alone, I think we need to buy time to make sure that we protect the vulnerable and also get our children vaccinated before we open up or abandon restrictions. I think, in my opinion, we should keep vaccine passes in place and really push our vaccination campaign.
You're right. And the mask mandate in place as well then?
Of course.
All right, Dr. Dan, as always, thank you very much for your insights today. And Dr. Kim here in the studio, thank you for your thoughts and your time.